One theory makes you larger, and one people makes you simple.
Your Health Matters with Karl Sterling on News Radio 570 WSYR on 106.9 FM and live everywhere on the iHeartRadio app.
Bubble, bubble, I dare bubble down. Find nothing just good is ruin hell.
Bring you the latest in health and wellness so you can get to the other things that matter. Here is your host, Karl Sterling.
Good morning. It's great to be back. It's been a couple of weeks off out of the studio. We had pre-recordings that we ran the past 2 weeks, which, whoa, I listened to them. I really liked them. Not because of me, because of the guests and the information. Well, anyways, my name is Karl Sterling, and you're listening to Your Health Matters. We're here at the News Radio 570 WSYR station in the studio, and I have my co-host with me, Elizabeth Brusa. Good morning, and how are you?
Good morning. I'm doing well, thank you. How are you?
I'm doing fantastic. I love coming in and doing this, and it's great to be back.
Yeah, it is.
It's nice to have a couple Sundays off, too.
Well, I had more than a couple, but that's okay.
You did? How did that work?
Well, you did all the work for the other two. I just didn't have to do anything.
Oh, yeah. So some of the guests, we really want to bring world-class, the top-shelf information. We need to have this. And so I was so lucky to have Casey Means come on. And thank you, everybody, because we've had some really good feedback about Dr. Casey Means 2 weeks ago, talking about the processed food supply and the, these health crisis that we're facing, which we're going to talk about today with our guests, too, about, metabolic health, diabetes, just the whole thing. It's really, I'm tongue-tied, so I don't usually get that way. And also Dr. Dale Bredesen, we touched on that last week with him, too. And, of course, he's the best-selling author and the foremost researcher globally in the Alzheimer's arena. So I appreciate all the great feedback from both of those shows. So we have a lot to talk about today in 2 hours. The first hour, though, I have a very special guest. We have a special guest with us. He's a friend of mine. He also happens to be, he was my physician, and I sort of still consider him that. It's a long story. But he was born in Syracuse. He has served, he's resident of family medicine residency class. He's currently with Family Care Medical Group in Manlius. He is married with 3 children. He has some hobbies, which include golf. I didn't know that. Well, you wouldn't ever want to golf with me, Doc, because, you won't want to talk to me anymore. Landscaping, running, and following the local sports scene here, SU football, basketball. And we're going to be talking about metabolic health. We're going to be talking about stress. So I want to introduce my very special guest and my friend, Dr. Anthony Rotella. Welcome, Doc. How you doing?
I'm doing well. Thanks, Carl. Thanks for having me back on. I appreciate it.
My pleasure. Yeah, you were on for a little bit there in July when we were subbing for Bob Lonsberry one day, and appreciate that.
Yeah, that was awesome. Yeah, and about the golf, I've golfed twice in the last 3 years, so I enjoy it. Doesn't necessarily mean that I do it often. So just putting that out there.
Well, I won't waste airtime with boring listeners with my golf stories. All I can say is that I have some stories, and they're really, really funny, but they weren't funny when they happened because the people I was golfing with never wanted to speak to me ever again. So that's how bad I am. Oh, man. So, yeah. So, Doc, yeah. Well, Doc, I appreciate you coming on because, we're facing what I see as a crisis, and it's been going on for a long time. We look at metabolic health, insulin resistance, type 2 diabetes, obesity. Of course, we look at, like Dr. Casey Means was saying, big food makes you sick, and medicine. No offense to any medical people out there, because you, Doc, are one of the forward-thinking ones, like Dr. Berry and Dr. Cobb and my son, Dr. Nick. But medicine keeps managing the systems. You know, everyone is used to popping a pill these days. And it's just not working out very well because people's health doesn't seem like they're feeling good by and large. But if we were to look at, maybe the first topic, if you will, touch on first of all, what is metabolic health? I'm going to ask you that. I mean, I know the answer, but I'd like to hear your definition. And then what is metabolic syndrome?
Yeah, so I mean, metabolic health is really just maintaining yourself in a good fashion, blood pressure under control, weight within a range that your body can sustain, activity level, blood sugar management, and metabolic syndrome is when that kind of all goes off kilter. The criteria specifically include 3 out of 5 of the following is what you need to meet to be considered having metabolic syndrome. Waist circumference greater than 40 inches in men, 35 inches in women, triglycerides at 150 or higher, HDL in males 40 or less, and 50 or less in females, blood pressure 130 over 85 or higher, or if you're currently on blood pressure medication, the fasting sugar of 100 or higher, or on blood sugar treatment with your medications. So all you need is 3 out of those 5 to be considered having metabolic syndrome. And unfortunately, in the culture we live in and the times that we live in, that's not difficult to attain. So,
no, I mean, we've got some notes here, right? We're looking at, this is fairly common. I mean, what is it? 1 out of 3 adults?
Yep. Yeah. My research came, just to make sure I had all the bases covered and just look up some interesting facts too. Part came from the Cleveland Clinic, National Library of Medicine, and the Lancet, which if folks are in the general public are looking to do some research, I would stick to Mayo Clinic, Cleveland Clinic. Those are great sources, with simple ways to explain things. Social media, they have their purpose. Try to avoid it. But yes, nevertheless, the 1 out of 3 have that, are considered having metabolic syndrome in the U.S. Big driver of that is obesity, and we'll definitely get into that in a little while. Last time I was on, we talked about how that was a big driving force. Almost 50% of the U.S. will be considered obese by 2030. So that's definitely something that we have to contend with as the general public and from a medical profession standpoint.
Yeah, I'm a lot older than you. I mean, all I can say is this. 50 years ago when I was 13, so what am I there? I'm 8th grade. I just remember middle school and even high school, right? We didn't have very many people, kids, like obese. We had some overweight, maybe a couple obese, but it wasn't the same back then. It just wasn't the same. Things have changed. So, we touched on that with Casey Means a couple of weeks ago, but I'm curious to know, and feel free to, digress and go wherever you want with this, Doc. But, for example, can you tell us some of the symptoms might include, let's say, of metabolic syndrome?
Yeah, absolutely. So you're going to want to look out for, fatigue is a tough one because that could mean one of many, many things that are going on with your body. But feeling more run down than normal, if you're drinking more water, you're urinating more, any blurry vision, skin changes, specifically dark spots on the back of the neck or in the armpit. Those are all signs of insulin resistance and elevated blood sugar. From a hypertension standpoint, that's considered the silent killer. That could go up, that could be elevated, and you have really no symptoms. And meanwhile, it's doing damage to your heart, it's remodeling your heart muscles, it's doing damage to the blood vessels in your eyes, doing damage to your kidneys. So really the very, very important to meet with your healthcare provider to get some lab work at least once a year, blood pressure check, complete physical exam, and rule out, possible causes or symptoms of, metabolic syndrome before they become very symptomatic and, we might end up in the hospital or in much worse shape.
Wow. Yeah. So when you said, we got 60 seconds till break, if you just touch on real quickly a few seconds of, you said remodeling the heart. What's happening?
So what can happen is the heart muscle itself can become thicker. the blood vessels within the heart have more plaque built up in it, so there's less blood flow going to the heart muscle. So the heart muscle might not contract as well. So high blood pressure can really do quite a bit to the architecture of the heart, the organ itself.
Yeah, well, that definitely doesn't sound too good. That explains a lot of things right there, though. Okay, we're up for first break already, folks. This is Your Health Matters here on News Radio 570, WSYR. Also available on 106.9 FM. We have Dr. Anthony Rotella as our guest. We're talking about metabolic syndrome. We're going to be talking about stress. So we're going to go off for a break. We'll come back in a couple of minutes, and thanks very much for listening. Okay, we're back. I just have a little thing I want to read. Laziness kills ambition. Anger kills wisdom. Fear kills dreams. Ego kills growth. Jealousy kills peace. And doubt kills confidence. I saw that and I'm like, whoa, that is really heavy. But if we read it backwards, it goes like this. Ambition kills laziness. Bingo. Wisdom kills anger. Dreams kill fear. Growth kills ego. Peace kills jealousy. Confidence kills doubt. I mean, I had to say that because I've been meaning to recite that for at least 6 weeks, and I always forget. Our special guest today is Dr. Anthony Rotella. You have a question.
Yes, Dr. Rotella, I was wondering, you said, the change of the heart, and I just want to know, because it just brought up my father in my head. I just want to know if this metabolic syndrome, it could be hereditary at all.
Yes, it can be. There's a lot of traits from, weight, blood sugar, control, high blood pressure. Yes, there is a genetic component to this.
Okay.
So it's really important that we control what we can control. Our activity level, what we're eating, and just trying to get ahead of the game, getting the annual physical, doing what we can preventatively to stay ahead of the curve, and if needed, prescribe some medications to help the body, do what it can't do. But it's very important up front to do what we can do to prevent any kind of progression. Yes.
Okay. Thank you.
So I just wonder, when it comes to this, let's say metabolic syndrome, what's the main driver and what's causing this?
So yeah, insulin resistance is really the meat and potatoes, no pun intended, of what's going on here. So what happens is there's blood sugar that's taken up by your muscles, your fat, your liver, and it's utilized for energy in storage. The pancreas is what makes insulin. So what'll happen is your organs, your muscles, your fat, your liver won't be able to take up that blood sugar and use it accordingly. So what your pancreas thinks is, well, we need to make more insulin. Mm-hmm. And after a while, all you're having is your pancreas making more insulin. Your body can't take up any more blood sugar, and you have high levels of blood sugar floating around in your body. That's what ends up doing damage to your eyes, the blood vessels and nerves in your eyes, your arteries in your heart. It can cause issues with your intestines and the normal muscle function of the intestine lining, your liver function, blood vessels and nerves in your feet. All of this can be affected by blood sugar because in the bloodstream it is very inflammatory. Another thing I do like to make sure folks know, not only in the pediatric population, but in the pregnant population, high levels of blood sugar, high blood pressure in pregnant women not only affect the mom, but also can affect the baby's health as well. So very, very important, not only from complete physical exam for the general public, but making sure that pregnant moms are getting proper prenatal care. Very, very important.
So it's possible then for a baby to be born with metabolic syndrome?
Not necessarily, but it can affect the baby's growth in utero and afterwards. Okay. They would have to be monitored and screened, afterwards during routine pediatric exams.
Okay. I have a thought here. We have quite a few people who come in and they have neuropathy or like diabetes related neuropathies, particularly from the knees down, but feet. And is this maybe part of that, or can it be part of the metabolic syndrome?
Yeah, so that can be due to a few different things, one of which is metabolic syndrome. You got to make sure from a blood flow standpoint that we're getting adequate blood flow down to the lower limbs. If we're not, you're going to have mostly symptoms of, pain in the muscles of the leg heaviness. When you're walking, you have to rest. And with rest, all those symptoms go away, and then you start moving again, and then that happens. But issues with the blood vessels in the leg can be caused by high blood pressure, high blood sugar. But circulating levels of high blood sugar can definitely cause inflammation in the blood vessels in the leg, narrowing the arteries, damaging the nerves, and it can cause that neuropathy you're talking about. So it's also from an orthopedic standpoint, you got to make sure that there are no nerve impingements in the low back, that there's no bone pushing on any nerves that are exiting the lumbar spine, going down the legs. There's no discs popping out to push on those nerves that are going down and supplying sensations to the lower legs. So numbness in the legs and the lower feet really needs to be evaluated for multiple reasons, but one of which definitely is blood flow problems from high blood sugar, high blood pressure. So that definitely should be evaluated by your healthcare provider.
We see a lot of this. I'm telling you, every day I'm working on people to get that blood flow. We have this device. We'll talk about it more in the second hour, folks, but we're going to talk a lot today about Power Plate, and it is the Rolls-Royce of whole body vibration devices, which has really, really helped a lot with waking up nerves and getting blood flow going, venous blood flow back to the heart. So we'll save for the second hour to talk about that. But boy, what you just mentioned, Doc, that is so common. We see it every single day. Yeah. So with that said, how about if you could give us some maybe other factors that contribute to metabolic syndrome?
So first and foremost is, activity and weight. A lot of patients probably sick of hearing this, but, move more, eat less. From a physical activity standpoint, walking is great. Aerobic activity is great. Resistance training, and I know we talked about this last time as well, is really, really important. Increasing that lean skeletal muscle helps on multiple levels, allowing blood sugar use and storage. And like we mentioned a moment ago, if you don't have a lot of muscle around and you have blood sugar floating around and where's it going to go? Where's it going to be used? So that's important. And also from what you do every day, Karl, increasing that skeletal muscle mass, allowing for balance and fall prevention. That helps you and your patient population as well. So that's a huge contributing factor. So moving more, not only walking and aerobic activity, but also resistance training. Mm-hmm. And before you do that, of course, make sure you're cleared from your doc and make sure whatever you're doing is supervised if you haven't done it in quite some time to know you're doing the activity safely. And then, of course, weight. Weight is very important. If we have a BMI above 30 would be considered obese. 27 or above is overweight. Working to get that down will definitely help blunt any effect of metabolic syndrome.
Did they change it from 25 to 27 for overweight? I'm just curious. And maybe I had the wrong numbers, but if what you just said means I'm not overweight anymore.
I know. So my apologies, Karl. It's 25. I am sorry.
Oh, no problem. I was hopeful that I'm not overweight anymore. I was 26.8 last time. I was like, well, I won't.
My son and daughter are getting ready down the hall, and I heard them hollering. I think
No, don't worry.
down the hall for a second. I apologize.
No, don't worry, Doc. You're cool. Everything's good. I know you got something to go to today. So, last minute too. Right before you're going to this thing. Thanks for joining us.
No worries.
Well, okay, it's still 25. Okay, I'm working on it. Yeah, I got these little love handles and this little belly. Well, you know me a long time. I yo-yo up and down. Right now, I'm on the lower end of the body fat scale, but well, We'll talk about that another time.
I'm next.
So,
I'm next, Ray.
so how about, okay, there's a time and place for medications, right? There's a time and place for medication, but that's not the only thing. I mean, we shouldn't be just relying on pills to put us into a healthy state. I mean, this involves getting more active, maybe taking more control over eating. But when it does come to medications, what can be helpful? Because if we combine the extra movement, the resistance training, and eating better, maybe less food and better food, if we combine that with medications, what meds are going to help us?
So, yeah, from a blood sugar standpoint, if you can tolerate it, metformin is a great medication. It's a generic medication, been around for quite some time. It's really the first-line treatment for diabetes, and there's some folks that, if you have prediabetes, are being started on metformin just to preserve the function of the pancreas. There are a lot of blood pressure medications that are first-line. They're called ACEs and ARBs. That can help control blood pressure. And the nice thing about it is they really take the stress off the heart, and they also can help prevent kidney damage down the line. So those are two medications that are very important to be on initially if they are required. And, if you catch things early enough, I've had patients come off of their blood pressure medication, their blood sugar medication, and they're strictly diet-controlled hypertensive and diet-controlled diabetics. So it's definitely possible to reverse course on metabolic syndrome, on high blood pressure, on high blood sugar. But at a certain point in time, unfortunately, I've used this analogy before, and I'm not sure if I've used it with you, Karl. If you take a thumbtack and you scratch the wall today, you might not notice it. It's just a scratch in the wall. But if you keep scratching with that little thumbtack in the same spot over and over every day with the same pressure, soon that scratch becomes a hole.
Mm-hmm.
So, and then you need to do more work to patch that hole. So if we can catch it when it's just a small scratch in the wall, there's a lot more we can do to repair it and prevent any further progression.
Well, the good news is that there's hope, because if we put in the work, even if we start just a little baby steps at a time, like I did years ago. Like, you didn't know me though when I weighed my heaviest; it was just obscene. But of course, I was one of those people. I got to digress. Oh, we got to go to a break in a minute, so I'll finish with this. We're going to come back from break in a couple of minutes, but I'll tell this story real quick. So remember, Doc, when you used to ask me, well, how much alcohol do you drink? Oh, hardly any, Doc. Oh, how many per day? Oh, no, only like 2 or 3 per week. Lie. So the thing is, the lies don't work because you're not telling the truth, and your doctor knows. I know you told me once, so you figure 3 times more than what they say at least, right? So I was one of those people, lie. Well, I stopped drinking, years ago now, so I'm good. We got to go to break. You're listening to Your Health Matters, News Radio 570 WSYR. My name is Karl Sterling. Dr. Anthony Rotella is our guest. We'll be back after this news break. Okay, we're back. Boy, it's really good to be back after a couple weeks off. We're with Dr. Anthony Rotella, who was my physician for years and a good friend. So, we left at the last segment. I took it out just by talking about, alcohol, and I would never admit how much I drank to you, I mean, that was in the early days of seeing you, but because later on I didn't do that, but because I had to make some changes. But for example, one of the things I think is really important is, I just thought of another story, not me though, of a guy who smoked, who I used to train, and I wondered why he was always winded, and he would never admit he smoked until I caught him outdoors smoking one day, off at SU, right, when I worked there. But being forthright and truthful with your physician seems like a really good idea. I mean, if you have 1 glass of something a night, or 4, there's a big difference between this, just for example. Or if you say you don't smoke, but you do, I'm sure, doctors are smart enough most of the time, they're going to figure out, well, I got somebody not telling me the truth. But isn't it a good idea to be truthful?
Oh, 100%. From multiple aspects. As far as the alcohol goes, what are you drinking and how much? It's gonna, what kind of effect are you gonna have on your liver? As far as what are you drinking, your blood sugar, levels will start to change. Your weight, the calories that are in these drinks, will all affect what we're talking about today, the metabolic syndrome here. So, letting us know what you're drinking, how much you're drinking, is important to kind of help diagnose and treat and take care of you and guide you along. It can also be, a sign of what else could be going on. Is there some depression? Is there some anxiety? Is there something else you're trying to deal with or cope with that we can tackle through not necessarily medication? There are a lot of medications that can help, but therapy, yoga, meditation, mindfulness. Doing those things is very important. Letting us know if something is going on can help us take care of you better. From a smoking standpoint, if you do smoke, you don't admit to smoking, lung cancer screening is vital. So if you don't let us know that you do smoke and be honest with how much you smoke, we could be missing a real important cancer screening you should be getting annually. Back a day for 30 years or more, age 55 and over. If you've quit and it's less than 15 years, all those are reasons to get annual lung cancer screening. So if you're not forthcoming, it's very, very important. We could be missing, potential cancer screenings, or we could be, addressing things in a different way than we should. And there's a lot of shame that comes with, not necessarily admitting to our vices. Everyone has something. Mine is sugar. I love chocolate, cookies. Forget about it. I could do that all day. Everyone has their thing. It's, and so there is no shame in that. Understand that everybody has their thing they go to help cope. So
Elizabeth had both hands raised on that one, Doc.
We're kindred spirits.
Mine is potato chips.
Yeah. So that getting over the shame aspect of it is very tough for a lot of people. So it's understandable. So you have a good relationship with your provider. Definitely talk about it, bring it up, and be honest.
I think that
we're people too, Carl. We deal with a lot of the same stuff. So
well, I'm glad you said that, because stress is real. I mean, you're talking about on the second hour. We're going to talk a little bit about the metabolic. Oh my gosh, the medical situation, and not enough providers out there, general practitioners, and just the stress level. And, my son deals with it in his job as an emergency room physician. You deal with it. We all deal with some kind of stress, but you got a lot going to deal with too. So the shame factor, I think that's really good to refer to, because there was shame when I knew I was drinking and I shouldn't be, for example. It was very embarrassing. I don't want to admit that to you, but the problem is you're shortchanging yourself, and maybe in the long term you're shortchanging a lot of other people, because maybe you become a burden. Maybe you just get so sick and you get cancer and all kinds of stuff, or you die, God forbid, right? I mean, seriously. I think you have a question, right?
Yes.
About diabetes. Okay.
Okay, so I was wondering, is diabetes or pre-diabetes the same as metabolic syndrome?
No. So pre-diabetes and diabetes are components of metabolic syndrome. Going back to the 5 traits that make up the metabolic syndrome, you have to hit 3 out of 5 to be classified as metabolic syndrome. So pre-diabetes and diabetes is distinguished by hemoglobin A1C. So if you do a fasting sugar, it's elevated, your provider should add on hemoglobin A1C. Now, what is that? That's basically a 3-month blood sugar average. How they test it is there's blood sugar attached to your red blood cells, as simple as I can explain it. And your red blood cells are killed off and then remade by your body every 90 to 120 days. So that's how they are able to see how much sugar is attached to your red blood cells, and it would need to be checked, every 3 to 4 months. Normal A1C is 5.7 or lower. Pre-diabetes, 5.6 or lower. Pre-diabetes is 5.7 to 6.4. And that's basically saying, we are on the verge of becoming diabetic. So what are we going to do about this? The weight loss? Do we start medication with metformin, which can help our bodies utilize the blood sugar and insulin that we are producing more efficiently, or is it strictly lifestyle changes? And then that should be tracked to make sure that it's going down or staying stable. However, if it goes to 6.5 or higher, then you are considered diabetic, at which point medication is recommended, because your body just cannot keep up with the blood sugar that is flowing through your bloodstream. So it's a different way of measuring your sugar in your body, and it's a component of metabolic syndrome, but it's not the same.
Okay. Thank you.
Thank you. Yes.
Yeah.
Okay, just so we stay on track here, because we also want to talk about, not yet, I got more to ask you before, the stress impact on metabolic syndrome. I want to save that for the last segment. But as we make my way down my notes here, what do you want to share next, Doctor? What sounds next logical to share with the listeners? We know some of the causes. We know if we eat less, move more, do some resistance, that's going to be helpful. What else can we do?
Yep. Yeah, so a really important thing, of course, quitting smoking. If you do smoke, quit. There's a lot of ways that we can help with that, so let your healthcare provider know. Sleep is a huge thing that people kind of brush under the rug. If you're not getting adequate sleep, all you're doing is increase your cortisol levels. You're increasing your body's under a physical stress, and you wake up in the morning and you're still tired. So if you're not getting adequate sleep because of a number of things, sleep apnea being the main thing that needs to be evaluated, that's where your oxygen level in your dip dips low enough, and your brain basically says, hey, we can't go into a deeper sleep. So you're brought up into this sleep range where you're sleeping, your body is resting, but you're not getting that restorative sleep. Mm-hmm. And it's in that state where your body undergoes more of a stress response. Cortisol is released. That's going to increase blood sugar, blood pressure. A lot of inflammatory markers can be released in the body, leading to heart disease, heart failure, kidney function problems. So sleep is a very big component that needs to be discussed with your healthcare provider. And you had mentioned it, stress, and just psychological stress, not taking proper care of your body, physical stress really can increase those cortisol levels as well, causing issues with blood sugar, blood pressure, triglycerides, all that. So managing stress with yoga, mindfulness, breathing, very important. Quitting smoking, very important. Making sure you're getting good sleep, very important. And that's you can determine that. So if you're told you snore, or if someone has said, hey, you stopped breathing in your sleep last night, those are things that you're going to want to bring up to your primary care provider to get a referral, or for a formal sleep study. Overnight oxygen test can be done, but a formal sleep study is a better option to diagnose and treat.
Yeah, our buddy Dr. Davin does those. Love that guy.
Yeah, great.
Thanks for telling me about him. Yeah, that's how I met Dr. Davin, is through Dr. Rotella. I love that guy. We got to go to a break in 30 seconds, but also just speaking about cortisol levels going up, I don't know who else has researched this, but Dr. Robert Lustig, author of Metabolic, great book, UC Berkeley, I think. But anyways, he talks about how visceral fat increases or can increase greatly from overactive or too much cortisol. So we've got to head out. Sure. We'll be back for one more segment with Dr. Anthony Rotella here on News Radio 570 WSYR. See you in a couple minutes. We are back with Dr. Anthony Rotella. Doctor, I have a question from our friend Marcia in Baldensville. How do you feel about statins for diabetes, let's say?
Yeah, so I am on a statin myself. I have a really strong history of heart disease in the family. I feel they are important in treatment of high cholesterol and heart disease. Folks who are diabetic should be on them as well. If you have diabetes, and you have not had a heart attack, you are actually considered, just having the diagnosis of diabetes, having had a cardiac event. And with the statins, we're not just looking at a number. on a lab test. What statins can do is to help to stabilize that soft plaque in the arteries of the heart, and prevent it, if you will, from decrease the risk of it breaking off, flowing downstream to a more narrow part of the vessel. And at that point, you have a little blood clot that's flowed downstream, that's blocking blood flow to the heart muscle. You also have, because of where it was ripped off in your coronary artery, some bleeding into the artery itself. Your body tries to repair itself, stacking up, different cells and platelets, specifically different, clotting factors to help stop the bleed. So you're forming a scab, and there's a little blood clot that's flowed downstream. So if we can decrease the risk of that breaking off, that is an important thing. There are side effects to those. Muscle aches are a very common one. CoQ10 can sometimes help with that. They curb some of those side effects. But if you're having those side effects, talk to your primary care doctor, your cardiologist, your nephrologist, whoever's prescribing it to you. There are some blood tests to make sure that your muscles aren't undergoing more breakdown than normal. It's called the creatinine kinase level.
Mm-hmm.
And then, readjusting. Do we add CoQ10? Do we change to a different stat? Do we readjust the dose? So there are things that can be done if you're having side effects, but I prescribe that from a preventative standpoint and a treatment standpoint for high cholesterol, diabetics, and heart disease, heart failure, high blood pressure. Yes. Yeah.
Okay. Well, the good news is, most of the time it seems like this can be reversed. We can improve things with lifestyle changes, along with medications. Other good news, preventable by controlling factors like you just talking that could lead to metabolic syndrome. And I'll tell you the preventative thing, we're going to talk about this in the second hour too. Just like, I'm going to say it now and put this out there. How would you behave if you could feel your cells dying, or your mitochondria underperforming, or disease manifesting? If you could feel this minute by minute, hour by hour, even just once a day, today I feel this way, I can feel every problem I have just a little more. The problem is we don't feel these things a lot of time. It's just a little bit, and years later, months, decades maybe, all of a sudden one day we got a problem. But if we could feel the degeneration, I think we'd be doing ourselves a favor first by not getting there, not feeling it. We're not going to feel a lot of stuff. So being preventative, taking control is really important. There's a cost to all this, though, right? I mean, the cost. Could you enlighten us a little bit about that?
Yeah, absolutely. In an article I was looking up on my research program today in The Lancet, which is a great periodical, the study done in 2020, looking back to 2016 healthcare spending in the U.S. So modifiable risk factors, meaning, weight, smoking cessation, alcohol use, things like that, diet, nutrition. What can we change about ourselves? We can't change our age. We can't change, men, women, things like that to really drive our risk factors for health issues. So there was overall a cost of $730 billion of expense related to modifiable risk factors. The 5 leading risk factors were, number one, high BMI. That was $238 billion. High blood pressure was $179 billion. High blood sugar was $171 billion. Poor diet, poor nutrition is $143 billion. And smoking was $130 billion. So there's a lot that we can change if we adjust the weight, if we adjust what we eat, if we do smoke. Quitting that can really help the blood pressure and blood sugar parts of those modifiable risk factors.
Wow, man, those are some big numbers.
Yeah, huge. That's huge. Yeah.
So can we go more into the impact of stress on metabolic syndrome? Because we are in a fast-paced society here in this country, generally speaking. We have a lot to do. We have busy schedules. We have all this technology, and we're used to instant gratification. I'm one of them. I want to know everything as soon as I can know it. So I get on ChatGPT or Google or whatever, and it's just the way it has evolved with technology. And of course, we got the whole thing in your career of A lot of patience and not enough time. But I got to say, Doc, I appreciate so much. You always take time with people. That's one of the reasons I stuck with you so long, is you actually listen, and I appreciate that. Thank you. So let's talk about this,
Carl.
Let's talk about this stress factor on metabolic syndrome.
Yeah, definitely. So it's a very big part of our life nowadays, is stress. We're getting pulled in so many different directions, and our body will really, at the end of the day, tell us. It keeps the score as to what's going on. We can kind of float through life and say, yes, everyone's fine, no big deal. But if we're not really taking care of ourselves, not only body, physically, but also, mind and spirit to get things aligned, we are missing a key component to it. Because if those are off kilter, what can happen is there's something called the hypothalamic pituitary adrenal axis. So the hypothalamus and the pituitary are in the brain. These are two organs that secrete hormones, and they affect basically almost every endocrine organ in the body and every cell in the body to some degree. So it's a downstream effect. So it starts in the brain, goes to the adrenal glands, produces a stress response, and the adrenal glands feed back to those two other organs. And the main goal of the hypothalamus is to keep your body regulated at stasis, nice and stable, gaining information from signals that are sent to it by your body. If that's off kilter, that's going to increase cortisol levels, like we mentioned before. That's only going to lead to, like we talked about, high sugar, high blood pressure, an increase in weight around the midsection. And the other scary thing cortisol can do is it can mimic the insulin resistance we talked about before that you can get from having too much weight on board. So if you have the stress response that is mimicking that insulin resistance response mentioned prior, you're going to have issues with high cholesterol, high blood pressure. You're going to gain weight in the abdomen, more like we said. There's been a few studies that have shown in pediatric patients testing the cortisol in their saliva, higher rates of that in their saliva secondary to some sort of stress they are undergoing, actually increases their propensity to take in higher fat and higher sweet foods or higher sugar foods to cope to a degree. Mm-hmm. There was another study that was done in the elderly that showed a lower skeletal muscle mass can lead to an increase in inflammatory markers in the body, insulin resistance, accumulating fat within the muscle tissue, and that's really tough domino effects because that will just increase your risk of broken bones. If your muscles are not contracting and pulling on those bones to wake them up, if you don't have enough strength in those muscles to keep yourself upright from falling over, that's all going to be a huge, huge factor in fertility and independence that a lot of folks want to maintain in there's later years. There's also a hormone called leptin. It basically tells you when you're full. It sends a signal to your body to say, hey, stop eating. We're good down here. We don't need any more. What can happen after an acute stress event, something that happens in your life? Some people don't eat after that, but some people do. And what can happen to this leptin level is the hormone can decrease by as much as 34% after an acute stress event. And that can cause people to consume more food than they actually need because that hormone is lower. Your body says, well, we need more food. You take in more food, and you can see how that cycle will run. And it's quite common in folks that have a normal BMI or in women that we see that effect with the leptin level. So it's interesting, yeah.
Well, it's interesting, and we got just about a minute left before we got to sign off for the hour, but this leptin thing is interesting because we talk often about on the show some of the scientifically designed processed foods go in, they short circuit leptin, so your brain doesn't get the message that you had enough, so you keep eating more because you're not feeling full. But then this whole thing about that level being affected, well, that's interesting. Doctor, it's so good to have you joining us, man. We'll do it again soon. By the way, you and me, lunch, I'm buying, okay, soon.
Sounds good, Carl. Thank you. Appreciate it.
Thanks for joining us.
You got it. Take care. Have a good day.
Yeah, you too. So thanks for listening, everybody. We appreciate you listening to Your Health Matters, and we really love to bring you top-notch, top-shelf quality education like my special guest, our special guest, Dr. Anthony Rotella. Doctor, thank you again. We'll be in touch. We'll be back for a second hour after the news break at the top of the hour.
Jesus. Love meaningful.
The proceeding was a paid program by Karl Sterling. The content of this show is that of Karl Sterling and does not represent the views of the station or iHeartMedia. Some of the information contained in this program has not been approved by the FDA, nor is it intended to diagnose, prevent, treat, or cure any diseases. Information has been for general information only, and before considering anything discussed, you should contact your doctor or primary care physician. The following is a paid program by Karl Sterling. The content of the show is that of Karl Sterling and does not represent the views of this station or iHeartMedia. Some of the information contained in this program has not been approved by the FDA, nor is it intended to diagnose, prevent, treat, or cure any diseases. Information hereafter is for general information only, and before considering anything discussed, you should contact your doctor or primary care physician.